Okay, we are going to demonstrate how to take vitals, and we take vitals on every patient, every appointment. That includes a temperature, a pulse rate, respiration rate, and blood pressure. So I have Ms. Moreno here to help me demonstrate what that kind of looks like, and we're going to run through kind of what your appointment looks like. So you've gotten your patient, you've seated them, we've updated medical history, asked them all those pertinent questions, and now I'm going to just explain to my patients that, sorry, that I've got, that I'm going to take her vitals. Of course, I get a scratch in my throat. Okay, give me a second, guys. Then I'm going to take her vitals, and so we're going to explain everything before we perform it. It's going to require me touching her, so I just want her aware of what I'm doing. I'm going to take your temperature first. Now, you guys all have a clear bucket in your operatories, and in that clear bucket, I've already set everything out, but you will find in there a thermometer. And we use this just not necessarily touching our patient. We're just going to scan their head with it. It has an on button that you'll turn on. The green light will come on. It'll signify that it's ready. And when you're ready to take the temperature, you're going to hold it up to your patient's head. You'll hit the start and let go. We've got 98.1. Okay, so you'll have your temperature there. Make sure it's reading in Fahrenheit when you take the temperature. Record that in your VOMAC or photo if we're updating. Next, what we're going to do is take a pulse rate on my patient. So remember, we're going to take the pulse at her radial artery. We could also take pulse at her brachial artery. And then, of course, we have our carotid artery here that we can get a pulse rate. But for our situation, the radial artery is ideal. Remember, we don't use our thumb to take pulse. We're going to use our pointer and middle finger. If I look at her thumb and I kind of come right down her thumb, I should be able to find the thumb. I should be able to find her pulse, her heartbeat, right about this area. So again, I didn't explain, but I'm going to tell her, I'm going to come here, I'm going to just kind of hold your wrist and look for your pulse. I'm going to tell her that I'm timing for 1 minute. We can put up a stop clock on the computer to double check. Now remember, I told you guys too that if you wanted to time yourself for 15 seconds, times that number by 4, you can do that. Or do it for 30 seconds, times that number by 2, you can do that as well. But I'm going to sit here, I'm going to set a time, and I'm going to count each little beat, each little pulse. Now, once I get that number in my head, I'm going to continue to stay here, pretending like I'm taking her pulse. But instead, I'm going to just kind of be looking ahead, and I'm going to be counting her respirations. So her respirations are every time I see her chest rise, I'm going to count 1. I see it rise again, I'm going to count 2. So she thinks I'm taking her pulse. I'm actually watching her breathe. I'm looking for signs of wheezing. I'm looking for irregularity. If she's breathing really fast, really heavy, or taking really deep breaths in, those are things I'm going to be just cautious of and note if that's occurring. Maybe she's anxious to be here. That could be a sign of general anxiety, okay? So, very good. After I've got that number, again, I could be going for a whole minute and counting, or I always say shorten it to 30 seconds or 15 seconds and then multiply to get your respiration. So pretty simple enough. I'm going to thank my patient, and last what we're going to do is take her blood pressure. Have your equipment ready to go. You guys have a stethoscope, and first thing you should do is wipe the ears of the stethoscope. I do a pre-wipe and a post-wipe, just in case they didn't get wiped prior. You never know. And so we'll do a little pre-wipe. I've got my stethoscope ready. Make sure you check the ears. They do go in a certain way, so they kind of should be rounded to fit into your ears. If you have them backwards, it's almost like they're trying to come out this way. You want them to go in when you put your stethoscope in. Okay, double check that you're hearing well, that your diaphragm here is not blocked, and that you can test it and hear everything really, really well. All right, but I'm going to put these away for just a minute, and I'm going to pull out the blood pressure cuff, or do y'all remember what we called this? I'm sure y'all do. We're going to call it the sphygmomanometer, right? It's really fun to say. And we're going to put this on. I'm a right-handed clinician, so I'm going to do this on the right arm. Now notice when you line this up, it's got an arrow that says artery index. So this is really helpful because I'm going to make sure I line up the brachial artery with that arrow when I put the cuff on. And so then all the tubing should be untangled, and I'm going to start right there and just make sure it's nice and fitted. Let me back up actually just a minute, because one thing I did not mention is making sure we have the right size of cuff for our patient. This is an adult large, which I think is probably pretty standard. Y'all have mostly adult larges in the operatories. But we do have smaller kid size, pedo sizes, and extra large sizes. So you want to just kind of line this up with your patient. We don't want more than an inch coming off each side when I line it up with her arm, because then that means you might have the wrong size. If this cuff is too large, then that can affect your blood pressure and it might be too low. If the cuff is too small, then it could lead to a higher blood pressure reading than is actually accurate. So just remember, double check the cuff size and you should be good. Most adults we have kind of a standard that we use for most adults. Okay, now I don't want it too tight, but yet I don't want it loose coming off of her arm. She can relax her arm down now. And the first thing I'm going to do is find the maximum inflation. So I can leave the gauge here attached to the cuff, or sometimes I like to just sit it in my lap to get it out of the way. It's really up to you. So to find maximum inflation, remember that's how high do I need to pump up my cuff to get an accurate systolic measurement. So the first thing I'm going to do is find her radial pulse again and feel for that thump, thump, thump. Once you find it, you're going to take your gauge, you're going to close, make sure this little knob here is closed so that you can pump it up. If it's opened, it's going to release all the air. So make sure it's nice and pumped up. And we're going to get that maximum inflation. So I'm going to pump this up. And remember, when we pump it up, it's going to basically collapse that brachial artery. And when it does, I won't be able to feel her radial pulse anymore. So once I can't find that radial pulse, I'm going to look and see where I am at on my gauge. Take that number, add 30 to it, and that will be what I inflate her cuff up when I take her blood pressure. So we're going to pump it all the way up. And I can't find the pulse anymore. So I was at 110. I'll add 30 to that, and it'll be at 140. I'm going to turn the knob so that all the air can be released, and I'm going to have my patient relax for a second. We're going to wait 30 seconds, and then we'll get her blood pressure. So just remember, when I'm taking her blood pressure, I'm listening for those cord cough sounds. I'm listening for the blood to pump through. When I pump this up to 140, it'll collapse the artery. And then I'm going to slowly release air from this little knob, very, very slowly. This will be something you'll have to do a couple times to get the feel for it, but very slowly I'll release air, and I'm going to watch and I'm going to listen. So I'm going to watch my dial, and I'm going to listen. When I hear the first ba-boom, ba-boom, I'm going to make note of what number on the dial I first heard it. And then I'm going to watch and listen while I'm slowly still letting air out for the last time I hear that, the thump. And then I'm going to take note on that number. So the first number, the higher number, will be your systolic reading, and then the second number, the lower number, will be your diastolic reading. So this is kind of how that looks. I'll put my stethoscope in now. I'm going to place it close to where that brachial artery would be. Sometimes I tuck it in just a little bit underneath the cup. I'm going to close the knob here so that I can pump this up. I have got my dial close. Now you can hold it, or you can just put it right here on the cup, whichever you're more comfortable with. And we're going to take her blood pressure. So let's pump it up. Remember that maximum inflation. I'm going to pump it up to 140. I don't want Elizabeth to get lightheaded and feel ill. Once I get to 140, I'm going to slowly start releasing air. Once I got my numbers, 116 over 78, I'm going to deflate the cup completely. I'm going to tell my patient what their blood pressure was. I'm going to stage it. Remember those stages? What did they say it was? 116 over 78, something like that. So think about what that might be. Is it normal? Pre-hypertension, stage 1, 2. Is she in hypertensive crisis right now? Remember those stages, they're very important. She, of course, is normal, under 120, under 80. All right, once that is finished, I'm going to take my equipment. I'm going to put it back where it belongs in the kit. I'm going to make sure that I clean off my earpieces again with the alcohol swabs. There's more alcohol swabs in the cart if you ever run out. They do store some in these kits so that you have them, so make sure they're nice and stocked. And then we are going to record the vitals in our notes for that day. Now, one last thing I will just say, if her blood pressure was elevated or high, then she and I would just have a conversation. I would ask her if she had caffeine today. I'd ask her if she'd exercised today. If she's a smoker, I'd ask her if she'd smoked today. Our whole list of questions, and trying to see if it's situational or if it's something maybe she needs to follow up with her doctor. I always encourage them to keep a log for 2 weeks and monitor what's going on. They can check at HEB. A lot of people have home devices, but just keeping in a log, if it remains high, they might want to schedule an appointment with their doctor. In our clinic, if her blood pressure was 160 over 100, then I would tell my patient that it was high, that I need to wait 5 minutes, and then I'm going to take it again. If it's still still 160 over 100, I'm going to give my patient some water, try to have them relax, and wait 5 minutes and take it a third time. If it's still 160 over 100, then we're going to call in faculty, we're going to call in the dentist, and there's a good possibility we won't have to proceed with treatment with a blood pressure 160 over 100. So just keep that in mind. But other than that, let's have fun practicing, guys.